All righty, we're ready.
Okay, thanks. Good afternoon, everybody, and thanks for being here today. I'm Lisa Emerson. I'm the Senior Policy Advisor facilitating House Bill 3243, Ground Ambulance Balance Billings Rulemaking. Today is our third Rules Advisory Committee meeting. And yeah, again, so just some meeting reminders. I put some information in the chat, but just a reminder, please mute your line if you're not speaking to help us avoid background noise. When we do get to a point of open discussion with the RAC members and division staff in the initial part of the meeting, if you would just please raise your hand, and then I'll call on you in order to help organize our discussion. And you can see the agenda that was also emailed out to you with the red line draft of the updated proposed rule set, as well as the comment submitters from since the last RAC number 2. And that's kind of the flow of what we will do today. We will have opportunity for public comment for those that are not official RAC members, and so we'll want to allow time for that. And then just upfront next steps, I went ahead and included them just so that we can, again, be organized, that there will be a period for written comments to be submitted, and I have set a date, initially anyway, of November 7th, Friday, November 7th. So and we will forego introductions because we've now met a couple of times, and please, though, introduce yourself and who you're with, what your organization is when you do speak. And I'd like to start the meeting off with diving into an overview of the written comments that were received by DFR. And we'll just go in order of how they're posted on the division's rulemaking website. So those are, while they were emailed to you, they're also available out there on our rulemaking website. So why don't we start with, I think it's Association of Oregon Counties. Is Tim Dooley on the call today? Let's see.
I am. Hello.
Hi, great. Welcome. Yeah, if you just want to emphasize whatever you'd like to of your written comments, you can discuss some or all, but you have the floor.
Perfect. Thank you. So again, Tim Dooley from the Association of Oregon Counties for Oregon County Governments. I think overall we are pretty happy with the draft rule. There's a couple of things that I wanted to note in our comment, some of which are addressed in the updated draft, which I appreciate. The one thing that was not there that I wanted to touch on was the sort of the cycle of how local governments update their rates. Usually for the GSOs that are publicly run, rates are going to be updated typically July 1st, which is the local fiscal year. And I know the bill and the rule have a January 1 reporting deadline, but also that 5 calendar day update of the rule, or excuse me, of the rate. So when a GSO updates the rate, we have to provide an update. So we were just hoping that there would be some language in the rule requiring the insurers to sort of query the database on a regular basis and update their rates internally, and then make sure that they pay the GSOs on that updated rate within a certain time period. We had suggested 30 days. So that was the one comment that I want to make sure that I highlighted, because it was not in the newest draft. So just wanted to throw that out there as the part that we were going to emphasize today. But otherwise, super happy with the definition of mutual aid and rates charged. And the draft rule looks more or less pretty good from our perspective.
Thank you, Tim. Appreciate it. Let's go ahead to the next commenter. Is Amy, may or may not be with us today, but is Amy available? Amy Hannafin? Okay. Don't believe she is able to join today, but you do have the comment letter from McMinnville Fire to refer to. I think we can go on next to Osberg. Do we have a representative from Osberg here today? Or any one of the other consumer advocacy organizations that are signers onto the letter that would like to review their comments? Okay, hearing none, just you have their comments, so please refer to those. Go to the next one. Okay, Sabrina, just wanted to offer you the opportunity to review the written comments on behalf of OSAA, and you can go over each one or just emphasize what you think is important for the RAC and the interested stakeholders to hear.
All good. Thank you, Sabrina Riggs for Oregon State Ambulance Association. I think, similar to Tim, appreciate all the work that's gone into the updated draft. We appreciate that many of the items that we've been discussing or requesting did make their way into this updated draft rule. So appreciative for that. There were a couple of items that we focused on for this most recent round of comments. And I think really the biggest outstanding piece is that providers need some way to identify which plans are participating or not participating in the protections, because of course the bill applies to commercial plans, and then ERISA and PEB and all are able to opt in, but providers will need to know who has opted in and also who has not opted in. And I think patients need that information too, so that if they receive a bill that they don't understand or have questions about, it's very clearly laid out if their plan is participating or not for them. So I think that will be important. I think Washington does that pretty well. And so we would love to see something like that in Oregon too. And then we did talk about enforcement of locally established rate. What we've seen in Washington is that there are some cases of insurers, even when there is a locally established rate, that is in the database and, has followed all of the things it needs to do to be the reimbursement rate, they're still defaulting to the backup Medicare percentage. And so some additional language around that, I think, would be helpful either on the enforcement side or just a reference to that requirement in the rule is always helpful. So the rest of our comments, I think, have been addressed already or are not, the biggest focus of our comment. We did have some concerns about new language that's in the draft rule, and I don't know if you want us to wait to talk about that.
Yeah, we can go ahead and wait because we'll probably jump into that pretty quickly. So,
okay.
Thank you. Thanks for taking the time to go over that. I think we have just one other comment that was submitted by another local fire department, but I don't believe John Tissey is on the meeting today, so just please refer to the comments in writing. All right, I think that's all of the written comments that we received, and so I think we should go ahead and just segue right into reviewing the current red line draft of the proposed rules, so that I can kind of go over each section and talk about what's changed, if anything. So we'll start out with this, and I will preface that for this meeting, we didn't quite reach a point where we were ready to finalize the actual Oregon Administrative Rule number in Division 53 that we plan to use, but we're very close to doing that. So we plan to revise this rule set and populate those numbers, and we'll be sure to share them with the RAC so that you have a moment to review those and weigh in as appropriate. But in this initial, draft rule here about purpose and statutory authority, there was no major change other than some grammatical change here and there. And we did replace the term insurers with health benefit plans, because health benefit plan is clearly defined in the definitions, and that is what this law, on a baseline applies to. So that was the only change made to the section, other than also one other change was to separate one sentence out of just having it be paragraph 1, we put it in paragraph 2, that the rules apply to health benefit plans issued, renewed, or extended on or after January 1, 2026. Does anybody have any questions or comments about this?
If they go through this
section?
car and do some touch-ups to it.
And if you're not speaking, could you please mute your line?
There's also
We
some
got some
marks here.
background noise. Unless Karen, you would like to take care of that for us.
I think
Thanks.
they took care of it
Okay,
themselves.
great, awesome. All right, seeing no hands or hearing no comment, let's go on to the definitions. So within the definitions, primarily what has changed is providing a definition for some placeholder identified definitions. We wanted to have a definition for mutual aid transport, also for non-resident and resident, as we know that ground ambulance service organizations, GASOs, may charge a different rate to non-residents versus residents for transport. And then the definition of mutual aid transport was offered by some of our RAC member representatives from the emergency management system. And I believe it does come out of the FEMA definition. So we've identified that definition here. So any questions or comments about this section? I see, Antoinette, you have your hand raised. Please go ahead.
Yes, hi, this is Antoinette from Cambria Health Solutions. One question and comment is that I know that if you jump over to, let's see, it's further down where allowed amount is mentioned, it references another OAR in which has yet to be identified. So do you know which OAR it is? Because I think it would make, we can try and mute this person that randomly speaking.
Yeah.
So I think it may make sense to maybe also move that definition, I guess reference, because I think you're citing to a definition under current rules, maybe move it out here under definitions as well.
Okay, well, thank you for sharing that, Antoinette. We'll take a look at that. But like I mentioned early on that we have initially identified a new series of numbers in the Division 53 rules that are unused in the 1700s. And we are going to populate those numbers. We just weren't quite ready to do that before this meeting. So that will be completed and sent out to the RAC to review before anything's official. Yeah.
Great. So I'm just trying to think like my actions after this RAC meeting. Is this something you would want in a comment letter or not?
So just to paraphrase back to make sure I'm understanding exactly what you're saying. So are you wanting mutual aid transport, the definition to not be included in this section of definitions?
No. It has nothing. No, we're satisfied with the definitions of mutual aid transport, non-resident and resident. I think what is missing here is the definition of allowed amount, given that we will be paying based on contracted, paid based on the published, rates. So, but then the term allowed amount is mentioned somewhere else and cited to another OAR that has yet to be identified. So I just wanted to.
We will identify that. We will be identifying that OAR, and we did reference it. We added some language to address your comment about allowed amount. So we do define allowed amount within the subsequent rules that we're going to be reviewing.
Got it. Okay, great. Thanks for that clarification. Thank you.
Oh, you're welcome. Thank you. All right, anybody else? Questions or comments on the definitions? So let's go ahead and move along to the next OAR this balance billing prohibition and consumer cost sharing for ground ambulance services. Nothing in paragraph 1 changed since the last change where we removed out of network and fixed a typo. All of this is the same until you get down to paragraph 2. Paragraph 2 here, the bulk of the matter here is a discussion about the time frame of when a consumer must be reimbursed by a ground ambulance service organization that charges in excess of the appropriate in-network cost sharing amount. This is a placeholder number for discussion. No final decisions have been made. We've weighed the comments from both the consumer advocacy perspective and of course from the ground ambulance service organization's perspective. We've received a lot of comments about that. And so this 45 days is an effort to strike a balance. And so this is definitely up for discussion. Remember, 45 business days is more than 45 days because, you know, we're not talking calendar days. So it is a little bit longer than the number identified. So let's go ahead and start with Charlie. You had your hand raised first. Please go ahead.
Yeah, and sorry I'm late. Charlie Fisher with Osberg, and you probably saw the letter we submitted with a couple other groups, actually asking this work group to shorten the 30-day window. So just, you know, strong, I think, objection to extending it to now what is, I think, more than 60 calendar days, which for someone who you know, is having to pay rent or manage their finances, waiting to get maybe $1,000 bill they shouldn't have been charged in the first place repaid is kind of outrageous. And I think the other thing I would say is just the easiest way to avoid having to pay someone back is to not inappropriately charge them in the first place. And so it just seems a little, well, I don't know. It's hard for me to really understand why we need to be extending the time frame when, you know, the whole point of this policy is to prevent this from happening in the first place.
Thank you, Charlie. Thank you for sharing your perspective. We appreciate it. Let's go ahead and let's hear from, I think, next hand is Sabrina.
Hey, it's Sabrina Riggs with the State Ambulance Association. We had asked for a little bit of a longer time frame from 30 days, so I appreciate that DCBS is striking a balance here with 45 days. We're fine with that. We needed a longer time frame, especially for some of our smaller agencies whose boards don't necessarily meet within that 30-day time frame, but do need to approve every check that would be cut if there was an erroneous bill that shouldn't have gone out. So appreciate the increase from 30 to 45 days. We're fine with that.
Thank you, Sabrina. Next, let's go to Tim.
Thank you. So counties are also good with the 45 business days. That helps address kind of what OSAA said as well for the small counties and our fiscal staff. I think this would, to Charlie's point, somewhat dovetail to what OSAA had asked for in identifying which plans are participating to make sure that we can reduce administrative error. So I think that would actually kind of dovetail nicely to reduce that ability to perhaps do an inadvertent overpay or overcharging if we can more accurately identify which plans are participating.
Thank you, Tim. And let's go back to Charlie.
Hi, yeah, thank you. I guess I just have a question. Is there any reason why? So I understand, you know, if a board's regularly scheduled meeting doesn't happen within 30 days, then you know, that poses a problem. But I mean, is there any reason why they wouldn't be able to just hold a special meeting in order to sign checks?
Is there anybody that has a perspective on that would like to respond? I will, you know, just remind that we don't think we're going to try to provide as much assistance to help avoid these circumstances, especially with the reporting database, with with our agency and divisions, complaint process as needed to assist consumers and other entities that have a conflict with anything involved in this law or rules. But again, we think it'll be an infrequent circumstance, but I just wanted to put that out there. There was a reminder. That's what I've heard from other stakeholders about this. But go ahead, Sabrina.
No, I think that covers it pretty well. I think as many resources as providers can have to understand who they should be billing or not billing will help cut down on this occurrence, and it certainly should help make it be pretty infrequent. And I think it just depends on each body's policies on what their process is for meeting and check writing.
Okay. Thank you. We have another hand up. Let's see, Tim, please go ahead.
Yeah, just to respond to Charlie, doing special board meetings for local government is difficult because we have to provide public notice and coordinate schedules among all of the board members, especially for small districts that are volunteer members for the boards of directors. So it just poses logistical concerns for us to be able to actually do that, and to convene a special meeting to issue a check would be very hard.
Thank you, Tim. And we'll definitely, be monitoring this rule, in terms of how things happen after implementation, and can address any, issues as needed. See another hand up, Jennifer Baker, please go ahead.
Sorry, getting unmuted there. Jennifer Baker with Cigna. I just wanted to understand who is enforcing this on the ambulance services. Is this going to be a DCBS enforcement?
This would be, if you refer back to the statute, there is reference to ORS 731.988 to the division has the ability to, or the agency has the authority to, apply penalties if there are any violations of this section of the law. So we would use the existing authorities that DCBS has to, investigate and handling compliance issues as needed.
So I appreciate that. I just see some inconsistencies here. Obviously it's 30 days, and that's what the providers have been asking for on insurers. And I'm inclined to agree with what Charlie's saying. I think, they're being incorrectly overcharged by an agency who should then be able to refund that money within a 30-day time frame. But if you're going to stick with the 45 days, I would ask that the agency consider some sort of interest penalty if it goes beyond that 45 days, because that's way beyond what consumers should be required to wait for repayment for being wrongly charged.
Thank you for your comments, Jennifer. All right, let's go to Rick Blackwell.
Hi, Lisa, and Rick Blackwell with Pacific Source Health Plans. When the first balance billing law was enacted, part of the challenge was that DCBS enforcement tools don't really, in the insurance code anyway, go beyond licensees. And so I'm kind of curious if we'll even be able to properly apply penalties to ambulance providers if it's found that it's necessary and warranted.
You raise a good point there, and we have yet to know whether that will be an issue, whether it will be challenged or not. But so far it appears to be of everyone's interest to coordinate and collaborate within this law. So, but your comments noted. Thank you. Go ahead, Charlie.
Yeah, well, actually, I do like that idea about interest because, I mean, in a way, someone who is, again, inappropriately charged a $1,000 bill, let's say, is giving a zero interest loan to an ambulance company for 2 months. So honestly, I mean, I would argue for any, illegal charge to have some sort of penalty added to it to disincentivize, this practice of basically asking for a 2 month zero interest loan from a consumer who probably, if they had known they didn't have to pay it, wouldn't have.
Thank you, Charlie. Thank you for your comment. Anybody else, questions or comments about this paragraph 2? Okay, seeing none, and certainly we welcome any written, your written comments, anything you'd like to reference or refer to in the law that would give us the authority to take such actions is appreciated. Paragraph 3 here, this was added just to ensure that when it comes back to the self-funded members, for those plans that are self-funded that opt into this law voluntarily, just wanted to make it clear that ground ambulance organizations should also not be balance billing the self-funded group plan members, or if they're in PEB or OEB, just making sure that's clearly stated in this section of rule. Please go ahead. Let's start with Antoinette.
Yeah, hi, thanks, Lisa. This is Antoinette again from Cambia Health. And this is also in response to, I believe, that comment submitted by another RAC member. Just to make clear that when it comes to these self-funded groups, and I'm not specifically referencing PEB or OEB, but other, self-funded groups, that they need to tell us that they want to elect to participate in the ground ambulance balance protection laws. So when they tell the insurer, then according to the law, we need to submit that election, meaning the carrier needs to submit that election to the DFR. At the last RAC meeting, the DFR did clarify, and Lisa, please correct me if I am stated this incorrectly, that the intent is to follow Washington's process, which is done on the division's website or the insurance division's website. They will create a form or the database in which the insurer can go into and inform the DFR that, yes, this self-funded group has elected to participate in the ground ambulance protection laws. So that's how AGASO would know that this, the self-funded group is participating. I guess I am assuming that GASOs will be using that website too, or that database to check. But please, DFR, please let me know how the process would go with respect to this election by self-funded group.
Thanks, Antoinette. Yes, you're correct. We're planning to follow Washington as their method as a model. We'll have a designated web page to allow self-funded insurance plans to fill out the form and attest that they want to voluntarily participate and comply with the law. And that is the plan. And we have a whole group of folks that are working on that internally. That, there's different steps that are needed to be taken to set that up. So yeah, that is our intent. I clarified that, I think, maybe verbally in the last meeting, but without putting it in writing, yes, that's the plan. And we're also planning to do some technical assistance meetings leading up to the January 1 implementation date, as far as this law goes into effect January 1st. So there'll be technical assistance meetings about the database and about the self-funded page. So appreciate your patience and please stay tuned for more information about that. Okay, Sabrina, please go ahead.
my comments are probably not needed, based on what you just said and what Antoinette said. So, I appreciate that database is forthcoming, and I think it'll be a
Yes.
helpful tool. Thank you.
Thank you. Okay, let's move along to the next OAR draft, which is payments to ground ambulance service organizations. You can keep scrolling down, Karen. All right, so we have had some changes here with some additional thought and internal discussion, feedback from written comments and verbal comments from the last couple of RACs. We needed to revise this language to make sure it was clear and in alignment with how that law states this part about how those payments are to be made. So essentially, if a local established rate does not exist, the law requires insurers to pay no less than 325% of the Medicare rate as published on January 1, 2026. So we have to set a point in time when we have the authority to make rules, but we can't just allow the Medicare rate to just update on its own. If it is updated, we'll have to revisit this, like some of our other rules that DCBS has through DFR. We have to meet and discuss, if there's a change in the federal rate, you can't just automatically update over time. So this rule will set 325% of the Medicare rate in time, January 1, 2026. So that's only if a locally established rate does not exist. If a local established rate exists, and that's the amount that the insurers are required to pay, or if they have a contract with an insurer, then of course that would be the in-network rate. So we wanted to fine tune this language, and I will be interested to hear if anybody has any questions or comments, but we think this is cleaner and more accurate and aligns with the law and the legislative intent. Okay, let's start with Rick Blackwell.
Thanks, Lisa. Appreciate the changes here. I think it makes sense given the state of the law, but I have to admit, I'm not sure I actually know what the rate is. Is there one Medicare rate for ground ambulance services that we can benchmark to, or is it, last time I looked, it seemed a little more complicated than that.
Well, this statement, doesn't go into great detail. There's a lot of administrative numbers behind the scenes. So I would assume that it aligns, but I'd be first interested. I'm not prepared to fully answer your question yet, but if there is somebody who works a lot with ground ambulance rates that would like to comment on that, I believe there is alignment when you look at the different CPT codes or the HCPCS codes, and I'm sure there is some alignment. Let's go ahead and is it Sabrina or Tim that would like to answer that technical question, or Sean, that are with the ground ambulance organizations?
I'll defer to Sean and Sabrina.
Okay.
Sean probably has the best technical answer on that, but I do have some comments on this section when it's appropriate.
Okay. Sean, if you're
Sure,
prepared, please go ahead.
Yeah, the way the ambulance billing world works, there are, and I can't remember if it's, let's say 11 codes that are billable for ambulance under Medicare, and they're basically, ALS or BLS, emergency, non-emergency, and mileage. And those are so each of them have a rate that Medicare has published every year, and they do an annual ambulance inflation factor update, which I will comment on later, not in answer to the question, but yes, there are just those set codes and that's it. So presumably these rules, you would go back and apply the percentage of Medicare to those codes that are appropriate for ambulance.
Okay, thank you, Sean. Appreciate that. Does that help, Rick?
I mean, I think so. It might be worth advocating for some kind of exhibit then to encapsulate what these codes look like at the point of time that the law applies, the statute applies, so that we know what we're talking about. I mean, I
Okay.
wouldn't want us to leave this meeting thinking that there's different versions, or I just think we need one set of facts before we get out of this rulemaking.
Okay, thank you. And I think we'll have some technical references in the form of, not only the website, the database website, but an FAQ and that sort of thing. So folding something like that in as a reference is probably a great idea. So thanks for suggesting it. Okay, so I'm out of order. I'm going to go to Charlie next, just because we heard from the ambulance. I would like to hear from Charlie.
Oh yeah, just I mean, really just a question. Is there a reason why, and maybe this is just what it says in the statute, it's no less than as opposed to equal to 325% of the Medicare rate?
We are just referring to the statutory language
Okay.
as closely as possible. Yeah, better than we were before. It's more accurate this way, we believe. So we welcome any more comments, even in written comment as well.
Yeah. Thanks for correcting that, Lisa. It aligns with the statute. So thank you.
Thank you. Well, let's go to Sabrina.
Hey, thanks. I think that the no less than language that is pulled from statute, so I appreciate that change is helpful. I do have some pretty significant concerns with tying the Medicare rate to a point in time. I don't actually think that that was legislative intent. I don't remember that being discussed during session at all. And I think if it was intent to pick a date certain or fix the Medicare rate, then we would have just picked an actual number and not tied to a percentage of Medicare. And further, I think if you look back on some of the comments following the first RAC meeting from some of the insurers, they reference in those comments adjusting the Medicare rate annually each year, which I think further shows that that wasn't discussed during session to just fix a rate and roll. So I think the 325% should not be fixed in time.
Thanks for your comment, Sabrina. We can take another look at that, but there is, I don't have the actual ORS reference, but there is, and Oregon has a non-delegation regulation where we can't just delegate to, say, the federal government's laws. There's certain circumstances where we have to revisit as things change over time. And so that is the biggest reason about why we feel that it has to be set in time. And sometimes we just annually have to revisit it, because I understand this is an annual process at the federal level with CMS as well. So we'll, take all these comments and discuss them more internally and see if we can provide further clarity. Thank you. And let's go next to Sean.
Thanks. And I appreciate the reference to the non-delegation portion of statute or whatever. I did want to point out that this would be extremely problematic for ambulance providers. Our cost of service goes up continually, wages go up, everything goes up. So there's nothing static in time. And you'll see that the other categories of reimbursement methodology, whether it's a state and local regulated rate, typically are indexed or revisited every year to some level. They don't stay static for long. Contract rates have built-in increases. So if there is a conflict in statute with the intent, which was that this would continually follow the ambulance inflation factor, when we had all of our discussions at the legislature moving this forward, it was never contemplated that this was going to be a set single benchmark. So I think that your comment sort of led me to believe that it's possible that these, because of not being able to delegate like that, there would be a process where this is revisited annually when that federal ambulance inflation factor is released, which is typically late fall. And a number of folks on this call will probably recall some discussions around how would we do the rate reporting and what frequency, knowing that Medicare updates its rate every fall. So I think with that in mind, another consideration would be looking at language that indicates in the rule that there will be a review process annually, following Medicare's fee schedule update or something, as a, I probably would defer to the legal people if we really need it or not the way it is, if we can just leave it, is exactly sort of like the other section that we just talked about where we took the words exactly out of the statute. I would leave the words exactly the way they are in the statute and not reference the date, but those are just my comments.
Thank you, Sean. That's helpful. So yeah, the actual the non-delegation has to do with it's in the Oregon Constitution. And so we have several rural areas where we run into this, and we have a process with our legislative process the agency does where we have a health updates bill oftentimes that we can sometimes, if we have to make technical fixes, sometimes that can be used. So obviously we need to do a little more discussion about this again internally, and appreciate the feedback. I have a question about how likely or how frequent is it that there are ground ambulance service organizations that there is not a locally established rate in existence? How, if we know that the locally established rate has to be paid, how often is there that one does not exist? I'm just curious in a general percentage. I'm not going to hold you to it. If you have an idea or
I don't know if
scenario.
I don't know if I have a general percentage to offer you, but we certainly have members that do not have a regulated rate.
And is there
Yeah,
a particular business reason for that, or?
usually it's more about the county that they're doing the
Okay.
service in, whether they choose to be a regulatory, in the scheme of their regulatory authority, whether they want to reach into rates or not. It's really
Okay.
kind of at that level.
Okay. All right, thanks. Appreciate it. Let's go in order of hands. Let's go to Antoinette.
Yes, hi, this is Antoinette from Cambia Health Solutions. Again, I just wanted to remind folks on this call that the law and the rules are effective January 1st, 2026. So in order for insurers to be able to operationalize this, and abide by the law and the rules, we need, and also to align with our benefit cycles, which usually starts, January 1st, each calendar year. So we need a set date in order to apply this. Okay, so given that the law and the rules are going to be effective January 1st, 2026, this is basically stating that if there is no locally established rate, the default is the Medicare established rate as of January 1st, 2026. We need a date in which to look to the Medicare rate, okay, to see what the current rate is as of January 1st, 2026. So it's not necessarily saying it's a rate set in time. It's basically saying that we would look at the Medicare rate as of January 1st, 2026. I believe that date it is necessary for us to be able to operationalize this and to know at what point we are looking at the most recently published Medicare rate. So at the time, there's no locally established rate. We would have to defer to the Medicare established rate as of January 1st, 2026. So we will look at what that rate is and apply that rate accordingly. So just wanted to clarify, this is how we interpret it, and this is how I believe it would be best to operationalize it. Thank you.
Thank you, Antoinette. Let's next go to Tim.
Thank you. So for the jurisdictions that don't have locally established rates, it's often going to be our rural and frontier counties that, again, like Sean said, don't get into rate making as part of their regulatory scheme. And I understand the concern about non-delegation. The problem is that if we aren't going to do or commit to an annual review, the intent of this is to be able to recoup the cost of service, and that gets eroded very quickly. So the longer we go between rulemaking cycles, the less aligned with the intent of the legislation we will be. So I just wanted to kind of put that out as a comment and see if we can commit to do that annual rulemaking to realign to where Medicare will be at that time.
Thank you, Tim. I appreciate that clarification, and I know that was in your written comments as well. And so, I believe that, the division would want to do its due diligence to be cognizant of that, the cost, the actual cost of doing business for the ambulance service organizations. But again, we'll revisit all this commentary here internally. Thank you. Let's go to Rick.
Thank you. I just wanted to echo what Antoinette said. I mean, we are mindful that we're going to have to make sure this is built into the next year's rates fairly quickly, and with binder filings and everything that has to happen, there's not a lot of time to take new changes into account in the rate development process. I'd always understood this to be kind of the default, like there's no, without any established local rate being set, this is really kind of the default rate that just applies. Unfortunately, the legislation is pretty specific about what that rate's going to be. And with case law and constitutional provisions in the way, I think we're kind of stuck with this static rate unless something changes. I would be curious if the department does think it can alter this by rule. I just think the statute's like kind of ties the hands of everyone, frankly.
Thank you, Rick. Appreciate it. Yeah, again, like I said, appreciate everybody's input here. We've talked about this a lot. We'll continue to talk about it. But as far as following what the statute says, we're doing our best to do that. And we've spent a lot of time discussing it. But again, I realize that other real world issues in the background that we need to think about too. So any other questions or comments on this portion before we move along? Okay, let's go ahead and scroll down. Karen, can't keep going there. So this is the same modifications as we've been discussing. If you pause right here, so the allowed amount is, we've tried and made an effort to define what the allowed amount means by referring back to section 1 and 2 of the rule. So that I think we talked about in the last RAC meeting, but I just wanted to call that out in response to Antoinette's earlier question that we've referenced in this rule. What are we referring to as the allowed amount? Defining it anyway in this rule. And then adding a paragraph 6 to this section. Again, we feel it's important to have this be embedded in this rule, that this also applies to the self-funded health plans, including PEB and OEB if they opt in to voluntarily participate. We can move on to the next rule. I already reviewed these changes last time. You can keep going. We just wanted to clarify it's government or GASO and not local government. This is another big major change here that we're trying to take the feedback that we received verbally and in writing about the timing of when the GASOs do rates, local rate review and a public process, and the rates are usually effective on the fiscal year, which is July 1. But we think it's really important that out of the gate with this law that we need, the rates that are in effect right now, if they exist, to have them submitted on or before January 1st. So remove the question mark that was out there inadvertently, set the time period of the initial rate submission on or before January 1, 2026, and then annually or thereafter will be annually on or before November 1st. So November 1st is a Washington example that we took note of. We had other suggestions of October. There may be other dates, but logistically for our division to implement this database tool and all the pieces that we have to manage, we felt that November date was a good point in time because these rate setting processes are on different timeframes. And then we also know that we have if there is a mid-year update to a rate by a GASO or through our local government, they've got 5 calendar days to notify us of the rate change. So this is our latest amendment to this rule in an effort to organize this process. And I'm curious about what folks think about this. Let's start with Antoinette.
So I understand. I'm just kind of going to talk about this in practice, just based on my interpretation of the clarifying provision that was added. So as I'm reading this, and as we all know, the law and the rules become effective January 1st, 2026. So am I interpreting this correctly that at least for this first go round, the GASOs must submit the rates on or before January 1st, 2026, okay? But then afterwards, the new cycle will be on or before November 1st. So when rates are submitted on or before January 1st, 2026 for this go around, I guess for the 2026 cycle, then, or part of the 2026 cycle, then the next time the GASOs will be submitting rates, if it's not changed, will be on or before November 1st, which then would apply going forward until the next November 1st, which would be in 2027. Am I reading this correctly? I'm just very concerned about that on or before, because the rules do not address when it will be published by the DFR, because it requires that other additional step by the DFR. So I feel like it's somewhat incomplete. It would make sense for it to state an actual date. It needs to be submitted and then annually after, right? And then when will be published so that insurers know the applicable dates of the rates.
Okay, thank you for your question. I'll try to answer it the best I can. So we've approached the rules, developing these rules, not as that DCBS or DFR is the gatekeeper of the GASO's rate effective dates. We're responsible to publish the rates that already exist, that are already in effect. So we're approaching this from making sure that we're accountable to gathering the data and publishing it. So that's the main approach that we're taking here. We don't have the statutory authority, we don't believe in the law to say when a rate's effective, because that's not, to me, we don't, not just to me, but the internal folks that have reviewed all this within DCBS and DFR don't feel that authority exists. So logistically, we're approaching this as gathering the data on or before January 1st so we can get a clearinghouse of data. Because this, again, this information is all available out in the public sphere. But we're responsible for gathering it and publishing it. And so this is the time frame that we felt that would make it viable for us to be able to do that in an organized fashion, if that helps.
Yeah. Thanks for the clarification, but then it just doesn't address the publication. If that's the authority or the accountability of the DFR. So that is still missing here. It just basically states when the rates must be submitted, but it does not address the publication of the rates by the DFR. And we highly recommend that it addresses that.
Okay. Thank you, Antoinette. Let's go next to Rick.
Thank you. I agree with Antoinette. I'd like to go a step further though and talk about what I think needs to be published by the department for us to have an established local rate for which we can reimburse. From my couple sessions ago written comment, I think an established local rate is one that's both been through a public process and has an analysis of the cost to provide the services. I think without the inclusion of some documentation to those points, and I'm not even sure how you would go about showing a cost analysis. Setting that aside, I think those need to be available so that we know that that rate's been actually established, and thus eligible then for reimbursement under the statute. So I don't see anything in the rule about how the service organizations are going to report that information that goes into developing those established rates.
Okay, thanks for that comment, Rick. Okay, let's go to Tim.
Thank
No,
you.
I'm sorry, I'm out of order. I'm out of order.
Oh,
I'm sorry, Tim.
No, you can go to Sabrina.
Sabrina had her hand up first.
Oh, that's okay. I just chiming in to say I think that those dates are fine. And when we are resubmitting, I think they're fine largely because the GISOs are going to be resubmitting their rates upon any changes. So within 5 days. And so they should always be current or within 5 days in the database. And so with that in mind, I think as we're looking at the annual submission requirements, which is also in the legislation, I hope that there is a expedited attestation process, I guess. And so if your rates are current in the database, I hope we can make it easy on the providers to attest that those rates are current and that there haven't been any changes because they would have already updated the rates within 5 days of whenever the last change was. That makes sense.
Yeah, that makes sense. Thank you, Sabrina. And I think you've put that also in written comment before as well. So we're trying to be, organized and, cognizant of all these issues and organized in our approach for gathering data and publishing the data as required by the statute or the law. Go ahead, Tim.
Thank you. I guess I don't have any issue with the November one. That's fine. I did want to ask the insurer folks though, if there was given that they operate on an annual basis, if we moved that, would it make their lives better if we moved it up to like October 1 so that you guys, so DFR could collect the data and then publish it and then they could have it. If we say, hey, these will be the rates as of January 1, 2027, 2028, every year. So that was the
I'm hearing
sorry,
yes. I'm hearing yes. Go ahead, Angela.
Yeah, that was in our comment letter to request for the GASOs to submit the rates on or before October 1st. And to also give the DFR about 5 business days to publish it. So October 6th. So it would be great to even a further benefit for the GASOs to indicate, when those will be effective. But if we get those rates and it's published by that time, then effective, January 1st, especially for this cycle, or thereafter, we know which rates to basically apply. It would be helpful for us to administer benefits. It's always helpful to refer to a date in which we can move forward with applying the rates or the benefits, et cetera, et cetera. It just keeps everything intact and in a cycle, order. So yes, so to Tim's comment and question, yes, it would be very helpful if we move towards that. And we have that recommendation in our comment letter. Thank you.
Okay, thank you. Let's go next to Scott White.
Hi, afternoon, Lisa. Scott White from Moda Health. I'll start off by just thank you to GASOs for being willing to move annual submissions up. That is very helpful for issuers. So thank you for that suggestion and seeming willingness to do that. So much appreciated. Lisa, I just wanted to clarify something. Is it accurate to say that regarding the DFR publishing and database here, that the date that the updated payment information is published to the database by the DFR is the date by which insurers would be expected to pay that updated rate? And I just wanted to make that clear because I know some individuals on the call were saying that we have a July timeframe where they're updating things or different timeframes, and of course GASOs are going to submit as soon as possible to get that updated in the system. But I think that's just a really important compliance date, that when it hits the database is when the compliance starts for health insurance issuers. And again, we would be checking that, when a claim comes in, so on and so forth, to make sure we're paying the correct amount. But just want to make sure that's a clarification that everyone understands, and that is in fact what the DFR is intending as well.
Thanks, Scott. I think you and other insurers have raised this question. I think it would be helpful to kind of hear it in practice in terms of, I think we've tried to choose dates that will follow the cycle that the GASOs follow. As kind of described in some of the written comments that we received or verbal comments from Tim with AOC and some others. But if I believe that if, say, the rates are effective July 1st, based on the fiscal year, this would be on or before January 1. We'd be gathering that rate. That rate is, still in effect. And annually thereafter, if it's November 1 or October 1, we're gathering those on or before that month. And that rate may or may not be, likely it is effective. It was already effective July 1st. And then, of course, if there's an updated rate, it's submitted within 5 days and we would make that update. Does this seem like it's getting us here from the perspective of the GASOs?
Yeah. Well, and I just
Or
want
the
to add one
insurers?
clarification. I think that Tim has this in chat too, and it makes sense to me. And it was in our suggestion for the database because we've gone through this in Washington. And so we tried to put a lot of suggestions in the database to help ourselves, of course, but GASOs as well get paid the correct rate. And I think having the effective dates and term dates in the database is really helpful for things like that. Because without it, you're in that scenario where that may have been effective in July, but the database wasn't updated till August. And what are we paying here? And then we get appeals from GASOs, and it causes a lot of confusion. So really having those really strong parameters in a database, and I know our team provided a bunch of suggestions for that because we have done this in Washington, and that will really matter, I think. So yeah, I think we're getting there. And Tim, thanks for your comment on that as well.
Yeah, thank you for all your comments about this, because we have been looking at Washington's tool closely. We've actually met with them. We'll continue to meet with them and exchange lessons learned. The insights that the insurers have learned and the GASOs having looked at Washington is all appreciated. So we are looking at that and taking that under very good consideration as a database is developed. And again, I mentioned earlier that ideally, we really hope we can provide a demonstration, a technical assistance meeting as we get closer to an actual ready to launch kind of situation from the data team. So I can't speak to that in specifics today, but I will definitely keep everyone here updated as we as I learn more about the progress. Okay. So thank you for everyone's comments on this. Very helpful. I don't believe I don't see any major changes in this next rule, although I did catch a typo, which some of you were maybe going to call my attention to. That was an inadvertent change where paragraph 2 went to paragraph 3. It shouldn't be. It should be 2. So I'll be fixing that. I was fixing a in our proposed. We made a wordsmith amendment to this. Instead of provision, we need to put an S on provisions, and somehow the numbering changed. So that was the only change that was made, was adding in the provisions of Oregon Laws 2025, Chapter 614. So that was the change here. And then if you keep scrolling, Karen, I don't believe we made any other changes to this section. So everything else should be the same other than grammatical. Like I think I capitalized the C in for chapter. Any questions, comments on the self-funded opt-in language? I'm looking at chat. So thank you for everybody's chats. We'll refer back to these and make sure we got everything. And I see Scott, go ahead, please go ahead.
Hey, Lisa, Scott White from Moda Health again. I apologize. I missed the second meeting, but with the self-funded groups, I thought I heard something earlier in the meeting today about issuers having to submit on behalf of self-funded groups, and I would assume that is just an option that we could submit on their behalf to the DFR, or are you only going to accept these opt-ins from self-funding groups from the group themselves?
I don't recall that question coming up last time, but it does talk about third-party administrators here. Please scroll back up, Karen, to the top of this rule.
I just know we're going to have ASO clients that say, do this for me. We want the bill, but go ahead and do this for me. So I just wanted to make sure that wasn't going to be I wasn't seeing an exclusion here, but it just mentioned the group plans electing and submitting that information. So
I don't see an issue, but we'll again follow the process that Washington follows pretty closely on the attestation form. And I'd have to refer to that form to answer your question. So I'm going to need to follow up with you just to be certain, unless one of the other insurers has insight on that.
So this is Antoinette. So in Washington, it is the claims administrator, which is obviously the other insurers, like for regions, that does the notification to the Washington OIC. They put the onus on the claims administrator to notify the insurance regulator if a self-funded group has opted into the mandate.
All right. Well, thank you for that, for clarifying that. That's helpful. Okay. Any, that brings us to the conclusion of our review of the draft rules. Thanks for all the feedback from everybody. Again, I will refer back to the chats. Thank you. Thank you for that, Rick, about the CH in chapter. Okay. I'll get it one of these days. Okay. This is now, unless anybody else have any other questions, I'm going to go ahead and open it up. Time for public comment since we're getting close to the end of our meeting. Is there anybody who hasn't had an opportunity, an interested stakeholder or any members of the public that wish to provide any testimony or public comment? Now would be the time to raise your hand. Okay, seeing none, hearing none. I will go ahead and go on to the next steps. As I mentioned, any written comments that you'd like to submit post this RAC would be due Friday, November 7th. And it is probably likely that we'll have another RAC meeting in early November. Just to, as I mentioned, for some of you maybe who had joined late, that we're going to apply the assigned or administrative rule numbers that we've come up with that we think fit well within the Division 53 rules. So we want to make sure that we get those populated and shared with the RAC for feedback. So I will have to keep you posted on when the next RAC meeting might be. We do feel that that these rules are going to have to be published in temporary form, irrespective of where we end up with a final rule set in the end, and we'll have a justification for that. But just due to timing, we're getting into a situation where we're coming against a time crunch, and we think it's important that we need to have these rules in place for the protection of consumers and for clarity for the GASOs and insurers. So that's what I can tell you right now, that we're on track to do that. But I will be in touch with you as soon as possible with an updated rule set with the OARs that we are designated for these draft rules. Scott, please go ahead.
Hey, Lisa. Sorry, Scott from Moto again. I had one more question that I meant to ask. And this was in our comment letter. And again, apologies, I missed the second meeting if this was discussed. But the fact that we have a 1/1/26 effective date for this, I think that's very clear. Have there been updates on likely a database won't be live for issuers to get rates from to pay as of 1/1/26? And so what are the expectations around that, safe harbors or payment expectations without a rate database live 1/1/26 when the bill becomes effective?
Yeah, I kind of anticipated that question might be asked, and so thanks for bringing it up. I can't say that there's any promise that the database will be ready and to be published right on 1/1/26. Obviously, the DFR is striving very hard to get there or be close. I can't speak to the safe harbor. That seems kind of reasonable request to some degree from the insurers about that issue. So I'll have to take that back, and then we can discuss it with the leadership. It's not really my final decision anyway, and we would certainly provide advance notification about that if we're able to provide that information. So thank you for the question.
Thank you.
Okay. And let's see, I've got a hand up from Karen, our rules coordinator. Please go ahead, Karen.
Hi, I do have a date selected. Haven't sent it out yet. It's November 13, same time, I believe, for our
Yeah, I
next
think that's
RAC
right.
meeting.
Yeah.
I'll get that sent out.
Yeah, I believe that's pretty likely the one we're going to go with, barring any unforeseen circumstances, of course, right? We just never really know, but that's what we're thinking about. Okay. Well, thanks, everybody. Really appreciate you being here today and for all your participation. It's really made a difference. So thank you. Have a good rest
Thank
of your
you.
afternoon. Okay.
Thank you.
Bye-bye.